So thank you all for being here today. Before we begin, I would like to do the acknowledgement of country, and I'd like to acknowledge the traditional custodians of the many lands on which we are meeting. I'm coming to you from Larrakia country in Darwin, upon the lands of the Larrakia people where sovereignty has never been ceded. I'd like to pay my respects to all elders, those of the past, the present and the future, as well as other Aboriginal and Torres Strait Islander people online and watching. My name's Dr. Kalinda Griffiths, and I'm an epidemiologist at the Centre for Big Data Research and Health at the University of New South Wales. I'm a Yarwoo woman, my family name is Corpus, and my country is in Broome, Western Australia. I'm going to give the weekly COVID statistics update, as well as an update on Aboriginal and Torres Strait Islander people. And this will be followed by Dr. Karina Powers, who will present the latest advice for respirators in Australia. So please put any questions in the chat, and we will be taking questions once we're finished presenting as well. We'll move on to the weekly stats update. Can we have slides, please? So there have been 415,494 reported cases in Australia over the past 2 weeks. And this is a decrease in case numbers since the last stats update we had. We're seeing continuing high case numbers for young people, with 47.1% of all cases in people below the age of 30 years. And the transmissibility of Omicron and active socialising of younger people are going to contribute to these numbers within those younger groups. There's also 1,261 active aged care outbreaks across Australia, with 1,957 new cases and 222 deaths in the past week. We'll move to slide 2. Vaccinations still require work. While 93.3% of people over the age of 16 years have had 2 doses in Australia, we should be reporting for the entire population. Only 75.82% of Australians have had at least 1 shot, while only 29.6% have received a booster shot. So there's still a way to go to ensure that all eligible Australians receive their vaccinations and all Australians are protected. We'll move on to slide 3. Nationally, 4,951 people were hospitalised in the last 2 weeks due to COVID, with 393 people in ICU and 121 people on ventilation. The majority of hospitalisations are across New South Wales, Victoria and Queensland. So the nation has had 899 deaths due to COVID in the last 2 weeks. This is more than doubled since the last fortnight, and it shows in real time how lifting restrictions of effective public health measures to mitigate the spread of COVID can impact a nation. We'll now give an update on Aboriginal and Torres Strait Islander health as well. So this is the first update from the OzSAGE Aboriginal and Torres Strait Islander Working Group since December 2021. So up until the 23rd of January, there's been over 40,000 COVID-19 cases impacting Aboriginal and Torres Strait Islander people. However, the reporting of Indigenous status is poor, with less than 50% of the total case numbers in the nation having Indigenous status recorded. This is a particular issue in New South Wales, where the highest numbers of Aboriginal and Torres Strait Islander people are. With this knowledge, we can now make the comment that COVID-19 case numbers are not accurately reported for Aboriginal and Torres Strait Islander people. National vaccination has passed 80% for the first dose and 73% double dose for Aboriginal and Torres Strait Islander people aged 12 years and older. This is still a little over a 15% gap between Indigenous and non-Indigenous people. So several SA regions in Australia still have under 60% of Aboriginal and Torres Strait Islander people fully vaccinated. There also remains concerns about the high amount of late or missed second doses in Western Australia, the Northern Territory and South Australia as well. So there are 6 main messages from the Aboriginal and Torres Strait Islander Working Group today. The first is to get vaccinated and to get your children vaccinated. While Omicron has a different disease profile to other strains with lower severity, the higher transmissibility of the strain means that more people are going to be affected. We've seen over 1,600 Aboriginal and Torres Strait Islander people hospitalised up until January 23rd. In the Northern Territory, where there has been lower vaccination rates for Aboriginal and Torres Strait Islander people, 9 in 10 hospitalisations are Aboriginal and or Torres Strait Islander people. We know that vaccines work to reduce disease severity from COVID, and that for those who have received the mRNA vaccines, the effectiveness is best among those who have received their booster shots. So all unvaccinated people should be getting vaccinated as soon as possible, and those who are eligible for their second and their booster shots should go out and get them as soon as possible as well. We do not know enough about the long-term impacts on the human body from COVID, although we know that there are ongoing damage to organs with long COVID. So within a population that already has higher rates of comorbid conditions, it's important to get all available protection to mitigate any potential harm that could occur. It has been the recommendation of the Aboriginal and Torres Strait Islander OzSAGE working group since quite early on in this pandemic that 95 to 100% of Aboriginal and Torres Strait Islander people over the age of 12 years need to be fully vaccinated. We're now seeing reasons why. The overrepresentation of Aboriginal and Torres Strait Islander people in hospital admissions and deaths is now apparent. 36 Aboriginal and Torres Strait Islander people have died. The rate of Aboriginal and Torres Strait Islander COVID-19 cases admitted to ICU or having died shows that in every age group, Aboriginal and Torres Strait Islander people have approximately twice the rate of ICU admission and death compared to non-Indigenous Australians. Our second message is that preventative public health measures work. Regardless of whether you agree with mask mandates or not, masks work to protect those people around you and yourself. So make sure you use your mask when you're in the proximity with other people. Make sure that you socially distance. And if you have been in close contact, get tested and isolate for 7 days. We must do this to protect our communities, our elders, and our vulnerable. If possible, try to keep shared spaces well ventilated or get outside as much as possible. Communities with limitations in housing and community infrastructure will experience reduced ability to socially distance and provide ventilated spaces, which will in turn increase the potential for transmissibility of this disease. This issue speaks to the housing issues in Aboriginal and Torres Strait Islander communities and the need for government support in the provision of infrastructure to prevent COVID spread as well. The issue also feeds into our third message to highlight our concerns for people in those regions that are impacted by extreme weather issues. This includes the top end of Australia, where it's currently cyclone season, so wet season, which sees more people spending more time indoors and the potential also for power loss as well. So more time indoors, again, means greater risk of transmission, being around people more. Our fourth message is our concern for food supply in regional and remote Australia. Currently, weather has seen South Australia Rail cease food and goods supply to the Northern Territory, which is further compounded by decreasing staff due to COVID. The Northern Territory currently has very limited fresh food supplies, and other regions in Australia are also being impacted by the lower staffing rates. Our fifth message is the recommendation for governments to better support our workforce and to protect our workforce appropriately. We are well aware of the limited availability of rapid antigen tests and PPE, so personal protective equipment, within health services across the nation. This is compounding an already strained health workforce. We recommend that financial support and required resources be provided as soon as possible to equip the health workforce, including the Aboriginal and Torres Strait Islander medical services, with what they need to fight this pandemic on the ground. Our sixth message is regarding the visibility of Aboriginal and Torres Strait Islander people in health reporting. It's now apparent that there's a fractured system in regards to data collection pertaining to Aboriginal and Torres Strait Islander people. We can no longer see accurate case numbers, and there are known issues with the accuracy of hospitalisation of deaths data that we've known for quite a long time. This issue requires redressing. Without these data, Aboriginal and Torres Strait Islander people become invisible. It means we don't exist. We recommend that the standard Indigenous question be regulated, a regulated requirement across all healthcare services, which it should be already anyway, including pathology and private health, and to support processes for the identification of Aboriginal and Torres Strait Islander people across all healthcare systems. We also recommend that an assessment of Aboriginal and Torres Strait Islander identification be undertaken in order to redress this very serious issue. It's clear that Aboriginal and Torres Strait Islander people are being disproportionately impacted by COVID-19 compared to the general Australian population. There is a need for greater efforts by governments to work with Aboriginal and Torres Strait Islander sectors and communities to support the prevention and impact of COVID upon Australia's First Nations people. I'll leave it here and I'll now pass to Dr. Karina Powers.
Thank you, Kalinda. So we urgently need better masks, that is respirators. Please share my slides. First slide, thanks. Respirators seal to the face. They filter small particles, and the COVID-19 virus is transmitted in small particles that we call aerosols. These small particles are produced when you breathe, talk, cough. They float and linger in the air like cigarette smoke, but they're invisible to your eye. Unlike respirators, where the air is breathed in and filtered through the mask material, when you wear a simple surgical mask, these don't necessarily seal around your face, so that unfiltered air comes in through the gaps. Wearing a respirator mask filters out the small particles containing the virus. Next slide. So you can see in the graph that if you're in a poorly ventilated, high occupancy area, that there is a much bigger risk than if you're in a well-ventilated outdoor area. However, Omicron, I would suggest, is shifting the colours on this graph in the green zones over to orange and maybe into red. So we really need a better way of preventing virus entering our body, and it's airborne, and that goes in through our mouth and nose into our lungs when we breathe in. Thank you to Greenhalgh et al. For this graph. And we understand that there's a bigger risk for people who have not had their third dose of vaccine. It's a significant protective factor, a third dose of vaccine, to stop you entering hospital. This is in the next slide, thank you. So you can see that the vaccine effectiveness is greater when you have the third dose. Next slide, thank you. We need to slow the spread of Omicron and the other COVID-19 variants, such as Delta, that's currently in the eastern states, for many reasons. If we slow the spread of disease by wearing respirator masks, we will allow time to ensure children are vaccinated. Some of the children have not had any dose of vaccine or have only received their first dose. It also, slowing spread of the disease allows time for adults to also get their third doses, and for some people, maybe even their first or second dose. And we have to think about people who have other diseases such as blood cancers and immunocompromise, and they're now recommended to have a fourth dose of vaccine. If we slow the spread of disease using respirators, we can reduce the risk of death and also the risk of complications of SARS-CoV-2, such as long COVID. We need to protect people in society who are not thought of and have been left behind, such as people with multiple medical conditions, the elderly, the isolated, those also who serve in public face-to-face roles where they've got more exposure. We need to reduce pressure on our health and ambulance systems. There's been plenty of examples of ambulances that have been delayed or not been available. And we need to look after people with disabilities and ensure that they and their people who their staff that care for them have respirators, and that will prevent disease. Having respirators slows the spread of disease and ensures business can keep functioning. Next slide, thank you. So compared to other countries such as the United States, where free respirators are now being provided, or Singapore, where free respirators are being provided, and some areas of Europe where medical grade masks or respirators have been mandated, Australia is an outlier, and we can do more for our population to prevent the spread of disease. Respirators are technically advanced on masks, and they do more than cloth or surgical masks to stop you from breathing in virus. Next slide, thank you. So this matrix is from a recent Conversation article, and you can see that if you wear respirator N95, the risk drops significantly. These respirators protect you from receiving an infectious dose of the virus. Next slide, thank you. Respirators filter the air that you breathe in, and they manage to do this because they form a close seal around your nose and mouth. And these are respirators that OzSAGE members are recommending. P2 respirators is the Australia-New Zealand standard. N95 respirators are United States, and FFP2 are European standard, and KF94 is the Korean standard. Next slide, thank you. Wearing a respirator has been shown to reduce your risk of infection 2.5 times compared to wearing a regular surgical mask. And when you wear a respirator, the risk of disease drops far enough that it can help offset some of the risk of being in situations where you cannot socially distance and you've had no choice. For instance, if you have to walk into a shopping centre and someone passes very close to you, if you are in a respirator, it will prevent you hopefully catching the disease better than if you wore a cloth mask or a surgical mask. Next slide. We recommend that respirators should be provided free to the community, with special attention provided to those with disabilities or in residential care. Government-led education campaigns are critical to help communities understand what to look for in a respirator, what types are suitable, how to wear it, how to check the seal, that you best be clean shaven to wear it effectively, and how to wash your hands before and after handling the mask. And people need to know when is a good time to use these respirators, and that's when virus is spreading in the community, but the government can help educate people on that time. Guidelines should be developed to assist the community to safely reuse the respirators. And the inventor of the N95 gave an example, if needed, that you can rotate your respirator each day over a few days. So you put them in a paper bag and just let them dry out and put them in a paper bag, and then you can reuse them. Of course, if they become damaged or the elastic's stretched or broken, you need to have a new one because you'll start to lose that effective seal. And also, if the fabric is damaged, you lose the filtration safety factor. So you can have a few masks and you are able to reuse them. Next slide, thanks. Now, what happens if you are unable to find yourself a respirator or the government hasn't supplied it to you? There is evidence that you can improve the fit of surgical masks, and you can do this by using elastic bands. You may have one elastic band and you link 2 others to it, and then you can place that and stretch them over your ears. And the middle band goes over the mask, the surgical mask itself, and that just holds it better to your face, so there's more of a seal. It's not a respirator, but it is improving the fit of that surgical mask to some degree, and hopefully that will drop your risk. You can wear your cloth mask over the top of your surgical mask. That may help to hold it closer to your face. And you can knot the side of the surgical mask and tuck the mask in and wear that. That smooths it out closer to your face. And you can put, if you've got ear loops on the surgical mask, you can put a toggle on the back or something that joins the ear loops, takes the pressure off your ears also, and that can pull the mask closer to your face. Next slide, thank you. So children who are over 2 years old and it's developmentally appropriate for them when they don't have medical conditions where it makes it much too difficult, can wear child-size KF94 respirators instead of cloth or surgical masks, and this will help protect them and help protect others from the spread of disease. Generally, these masks are more comfortable. The respirator type is more comfortable. People with certain medical conditions such as chronic obstructive airways disease may not tolerate a respirator and may just be able to cope with a loose surgical mask. So sometimes respirators, it's not possible to wear them. Some people may want to have their respirator formally fitted to reduce their risk of infection, and there is sites they can contact that have occupational hygienists such as RespFit that can fit their respirator for them. It's a degree of safety up from just simply putting a respirator on. They try different respirators and make sure which one would better fit your face and seal better. Next slide, thanks. So in the document that we are releasing today, there is a link to a video that shows those comments on how to improve the fit of a surgical mask. It's a good video. Members have watched it, and we think it was worth sharing with the community. We need to remember that respirators are a key part of the ventilation and vaccine plus strategy. Respirators themselves are part of several different practical controls that we can do to help stop the spread of disease. Thank you.
Thanks, Karina. I'm happy to take any questions now. If anyone has any, if you want to put them in the chat. I've got a couple here already that we'll start off with. And I guess it's a good follow through with your last comment. And it is wearing respirators. Is that enough?
Well, from an occupational medicine point of view, the respirators are one control level in the hierarchies of control. So they're one adjustment or mitigation you can use in your life to decrease your risk of disease. But of course, vaccines are very important. You wouldn't go without those. Making your air that you breathe safe. So safe indoor air is important. So having good exchange of fresh air in your house or in businesses that people enter through checking if you can, if you've got access to a carbon dioxide monitor, checking that those levels are below 800, ideally about 600 parts per million, checking that you've got good exchange, maybe using child-safe fans to improve cross-ventilation, considering how your air conditioning is set up, whether you can have a better outside airflow intake come through, using HEPA filters. All of these things are very important. Obviously, there's other controls that we can now use in society, such as the rat testing, if you've got a program of that to be able to use in your business, or individuals will often just check before they're going to visit a vulnerable relative. But these things are useful to help slow the spread of disease throughout the community. And even how you just go about your day-to-day life, whether you're in a car with others, that you had absolutely no choice to be in a close proximity to others, having windows down, where people are sitting in the vehicle, where the air is flowing. It's all very important to stop the spread of disease. Thank you.
Fantastic. Another question here as well is that there are a range of masks that are sold in hardware stores in places like Bunnings and other stores around Australia. Are they okay to use for COVID? And what should people be checking when they're looking for a mask?
Yes, so you look to make sure the mask or the respirator is to standard. So Australia and New Zealand have the 1716 2012 standard P2, and you'll see on that previous slide that there were standards for the N95, the FFP2, the KF94. So you'll often see P2s, particularly in hardware stores, and they're an excellent choice for helping stopping the spread of disease.
Right. And so should people be looking for like a TARGI approved, that sort of thing, Karina, on there as well? Should there be?
Well, some of these respirators that OzSAGE is recommending don't necessarily come under TGA approval, but they are made to a standard, and people may order them online from overseas websites. So as long as you can see that they've come with their standard and that they're these stamped with these codes, that's your best bet that that's not counterfeit.
Right. We don't have any more questions in the chat right now. I'll give everyone just another minute if there's anything that you want to address, either with the respirator discussion or with the Aboriginal and Torres Strait Islander discussion as well. If not, I'm happy to take questions out of session as well. And I'm sure Karina would be happy to be contacted regarding the release as well. All right, well, we might finish up here. Is there anything else that you wanted to cover off, Karina, before we finished up?
No, thanks, Kalinda, but I wish you all very well in the north of Australia. It's very difficult in regional areas. The least we can do is, if we can access these better masks, which are called respirators, it will help slow the spread of disease and take the pressure off our country hospitals and our remote communities who are really starting to struggle.
Thanks, Karina. And there we have it. I'll leave it there. And if you need any more information, please go onto the OzSAGE website, ozsage.org.au, and please get in contact if you've got any other questions as well.